Thanks so much. Thanks for being here. So when I started studying what happens when abortion is illegal, I thought I knew what I would find. I figured I'd find higher birth rates and fewer abortions and lots of women dying, right? Because that's what we're all told, or at least that's what I was told, happened prior to 73, and that's certainly the terms along which we engage when we fight over abortion today in the States, and it turns out that I was wrong. I came to the study of abortion indirectly. It was an outgrowth of the work that I had done on mothers who kill their children. It's a surprising line of cases, really, in this country. You think, okay, there's legal contraception, there's legal abortion. Why are women killing their kids, right? So I studied hundreds of cases. I went to Ohio and interviewed 40 women who are in prison for having killed their children. And I met them with not just like the eye of a person who's a lawyer, but I met them with my public health eye. I have a master's in public health, and it was pretty easy with that eye to see the patterns in their cases. And they were cases that ended up having nothing to do with the lack of access to abortion, because in fact, the women who are in prison for killing their kids wanted their children for the most part. They were women who were, in many cases, trapped in a struggle of such chaos that it was appalling to me to think that we actually shared the same country, the same nationality, and their lives were so filled with chaos that was invisible. Extreme isolation, extreme mental health challenges, poverty, challenges in parenting that would have been visible from long before they became pregnant, and challenges that anybody hoping to prevent cases like this in the future would have had to really begin with as sort of a first principle. When I asked them why they didn't have abortions, they told me, like, the being a mother was the thing I most wanted to do, most important thing in my life. So I started to wonder whether in countries where abortion is illegal, you'd have a very different pattern. Like, would mothers who kill their children in a country where it's illegal be mothers that couldn't get abortions, or would they somehow look like mothers in the States? And so with that question in mind, I started to travel. And if you look at the map, it was really clear where I wanted to go. I wanted to go to a red country. Those are the countries where the laws against abortion are the most restrictive in the world. And again, when I went there, I already knew what I was going to find, right? I figured we wouldn't find very much abortion, and we'd find a whole lot of women dying in hospitals. So in 2008, I went to Santiago, Chile, and I met with doctors and lawyers and women's health advocates, and I was looking again to see what happens with maternal filicide, with mothers who kill their kids in a country where abortion is illegal. But I got distracted right away. Like, literally, the first interview I had was with a doctor in the only adolescent health hospital in Santiago, and I went in and I was all set to ask my infanticide questions, and I started with, like, in a country where abortion is illegal and women can't get abortions, and he said, wait, stop. You can buy abortion drugs on the street anytime you like in Chile. It's just not that big a deal. I went to the leading defense lawyer in the country, who's the person who handles the cases of people accused of abortion-related crimes, and I said to her, so talk to me about this ban on abortion. Like, how does it work? And she says, like, there are maybe 5 prosecutions a year in this country. They're against doctors for the most part. So I came home just scratching my head. Like, if you've got a complete ban, the strictest law in the world against abortion, and you've only got 5 prosecutions a year, and you've got people buying drugs on the, like, what on earth is going on? Within a couple of months of getting back from Chile, I was invited to go as just a fly on the wall to a conference in San Salvador, in El Salvador, which was the first gathering of advocates against brand new abortion bans in Nicaragua and pretty new abortion bans in El Salvador, just sharing notes, like what's happening in your country under your ban, what's happening in our country. In El Salvador, unlike Chile, women are actually prosecuted and they're in prison. And so I was like, okay, I'm all in. This is super interesting. I went home, I wrote grants, and I went back over the past 10 years 9 times. I'm hoping to go back again in May, not to do more research, just because I've I've fallen in love with a number of people there and want to go see them again. But I went back to El Salvador trying to answer now a new question, which is, what happens today when abortion is illegal? Because clearly my set point, which was back in 1973 when Roe versus Wade was decided and abortion became legal, clearly that set point was too old. Right? So in El Salvador, I met with lawyers, judges, government officials, professors, activists, religious leaders, people on all sides of the issue. I also was able to get into the women's prison in that country and interview women who are incarcerated, as well as formerly incarcerated women. And during our time today, I want to share what I learned about what happens when abortion is illegal. But I want to share it not just because it's so interesting and important for us to know what happens in El Salvador. I want to share it because I'm convinced, and I want to convince you, that everything I learned there and everything that's happened there would happen here. So, first thing that happens, so this is El Salvador's law, just so you see, like no, absolutely no exceptions, not even to save the life of a woman. So the first thing that happens when abortion is illegal is actually what doesn't happen, and it's that abortion doesn't go away. And this is a bad slide. There's so many numbers on it. I've highlighted the numbers you want to pay attention to, and they're the numbers that show that there are more, the rate of abortion, actually just in terms of raw numbers in Latin America, but also in terms of the rate, is higher in Latin America, the red part of the map, than it is in this country, and that if you look at it just a little bit more carefully, you'll see that between 1990 and 2010, between 2010 to 2014, the rates are dropping in our country, dropping pretty dramatically. The abortion rates in Latin America, with the strict laws, are actually on the rise. El Salvador is a country of around 6 million people, and it is a country where, because it's illegal, it's hard to figure out what abortion on the ground really looks like who's having abortions. But one thing is for sure, it is a very poor country. It's a country where the average person lives on less than $5 a day. 40% of Salvadorans drop out of school by 9th grade. Contraception is actually okay. It's legal. People think, oh, it's a Catholic country, you can't get family planning. No, you can actually get family planning if you can get yourself to a clinic. Right? So most adult women in El Salvador use contraception. Most teenagers don't. The shame and the stigma around family planning are just very old school norms around that really inhibit any conversation around teen sex and contraception. But that's only part of the story. The other part of the story about unplanned pregnancy has to do with rape and domestic violence. Sexual violence against women is so commonplace in El Salvador and so unreported and unprosecuted that when you go on the U.S. State Department website and look at their travel advisories, like, I want to go to Salvador, what do I find out about El Salvador? One of the first things they list to American women is a warning. Rape is commonplace and is not, or there are no arrests and there's no prosecutions. You go there taking your life in your hands as a woman. It's also one of just a handful of countries in the world, unsurprisingly perhaps, where teen pregnancy is on the rise, as well as teen motherhood. 1 in 3 births in the country of El Salvador is to a teenager. So, as far as we can tell, the problem of abortion is driven by the problem of poor girls not having, and poor women not having control over who has sex with them and over when and how they become pregnant. The interesting thing I found when I started digging into the statistics about abortion rates in a country where it's completely banned is that even by the government's own admission, the last time they studied it was 2005 to 2008, but even by the government's official admissions, there were almost 20,000 abortions. The Guttmacher Institute, a U.S.-based research institute, estimates that the rate is actually much higher, probably around 35,000 abortions a year, again, in a country of only 6 million people. So what is the face of illegal abortion? This is the face of illegal abortion. This is Cytotec, and it's an abortion drug. And at the risk of being a little bit sort of pedantic and professorial, I need to tell you what this is and what it isn't, because Americans get confused about abortion drugs. So this is not the morning after pill. The morning after pill is what you take within 72 hours of unprotected sex. You can buy it over the counter. It prevents implantation. It's actually not available there. It's also not RU486 or mifepristone, the drug that we take in this country for medical abortions, which is a drug that if you take it in the first trimester is 98% effective, pretty quickly becoming the way in which we have early abortions in this country and elsewhere in the world. That drug is also not available in those red countries that I showed you. It's actually half of the drug we take, but it's a half that works 90% of the time. This is a drug that's widely available, out of patent, so pretty cheap, widely available throughout the world for treating ulcers. Right? Who knew? It also brings on contractions, and taken in the first trimester will give you strong enough contractions that you will have a miscarriage. You'll miscarry your pregnancy, and you'll miscarry it fairly safely, meaning that this isn't a drug that is causing women's deaths. Right? Before I talk in detail about how sort of what the risks are, though, I want to talk about how you buy it online with a smartphone. In a country where people are living on less than $5 a day, everybody has access to a smartphone, and you can Google it right now. Right? It is amazing how many people on the street with backpacks are willing to sell it to you. It's also for sale in pharmacies, although whether a pharmacist will sell it to you or not depends on how persuasive your story about the ulcer is. Right? So when I say that it's safe, what I want you to do is look here at the death rates from 1990. These are your deaths from illegal abortion, or from abortion period. Unsafe abortion is the World Health Organization's term for any abortion that happens without the permission of the law. But what I want you to notice is the rate at which women are dying and how it's declining, even in Latin America. And what's also relevant to notice is that in 1990, they didn't have a complete ban. Right? In 1990, the only country in the world with a complete ban was Chile. And since then, you've had, in Latin America, Dominican Republic, Nicaragua, Honduras, El Salvador, all enacted their bans in the years since then, and the abortion rate is still declining. So the thing that we have in our head, that you make abortion illegal and women die, is true. There are still some women who die, but it's nothing like the rates of illegal abortion in the years prior to Roe v. Wade. Right? Now, who are the women who die? Who are the women who are still at risk? There are still illegal surgical abortions. Right? And they're still botched on a regular basis. Doctors are better able to fix it, right? When you've had a botched abortion, better able to save your life. Our infection control means have gotten better. I think our surgical responses have gotten better, but those still happen. There are still women using folk remedies. Battery acid, douching with God knows Coca-Cola, or what have you, right? Still all of the folk remedies that you hear about. But the more complicated and commonplace problem with abortion drugs is taking the wrong dose at the wrong stage of pregnancy, or perhaps the wrong drug, right? So the barrier to abortion ends up being an education barrier and a geography barrier, right? It's wait, where did it go? The risks of illegal abortion depend upon how good your information is. Do I have access to the right drug? Do I know how far along in my pregnancy I am? It will give you contractions and end your pregnancy at 5 months. You will hemorrhage. Right? You may, in fact, die from blood loss at that point. So all of those risks depend on these factors. And again, if you imagine the teenage girl that I told you about, the kid who dropped out of school in 9th grade and who doesn't have access to family planning and who's living in a small village in the country far away from the guy with the backpack on the street who has the drugs to sell you, you understand right away, oh, right? And she finds out about her pregnancy later because she's never had sex education, so she doesn't know the signs. That's the face of the risk of illegal abortion in El Salvador today. So what happens when something goes wrong? You've taken the drug and something goes wrong. You end up in the hospital, and you end up in the hospital bleeding, and the hospital turns into sort of a crime scene investigation. Now, let me be clear. Women show up in the hospital bleeding all the time. We don't talk much about miscarriage in this country, but 25% of our pregnancies end in miscarriage. Women show up bleeding at hospitals all the time, right? The question is how the doctor responds. So I'm going to tell you a little bit about how the doctors respond in El Salvador. So I shot this picture out of the window of a cab, so it's not quite clear. This is the center of Colonia Medica, which is like the neighborhood with the fancy doctor's offices and the private hospitals. And at the center of the neighborhood is a statue of a hand with a little fetus in it, right? Yeah, a little fetus. The thing I thought would happen, again, like I thought I knew, right? So what I figured would happen is that a woman would show up bleeding at the hospital, and the doctors who believed abortion was murder would call the police. And the doctors who maybe thought like women's health, my obligation is to save the woman's life, wouldn't call the police. I just figured that what happened in response to illegal abortion would depend upon what a doctor's fundamental belief about abortion was. I was totally wrong. Totally wrong. The doctors, first of all, when they find a woman who's at the emergency room bleeding, have to figure out, they might suspect something, but they have to figure out, okay, has she done something to provoke this miscarriage, or is it just a miscarriage? Because all we know for sure is that she's miscarrying, right? It turns out that in El Salvador, and still today in this country, there's no way to know, unless she confesses, whether she's taken misoprostol, Cytotec, that drug, right? I mean, I imagine that somewhere in this country we're working on tests that will detect whether you have this drug in your system or not, but in El Salvador, where you're living on $2 a day or $5 a day, they don't have a fancy drug. So it really is impossible to know with an early abortion whether a woman has done something or not, unless she confesses, or unless what she's had is a botched surgical abortion, right? In which case you'd have signs of a perforated uterus or something like that, right? The other thing that happens is that the law prevents doctors from disclosing, from breaching patient confidentiality. The law and the medical ethics in El Salvador actually mirror the law and the medical ethics in this country, and really in every country around the world. The Hippocratic Oath has been in force for hundreds of years now, and the doctor is obligated to maintain the confidences of a patient who comes to her with a medical problem, right? What happened in El Salvador in 1998 when they banned abortion was that the official criminal justice system, if you will, the attorney generals, went to hospitals and did grand rounds, public hospitals, private hospitals throughout the country, to say, you now have a duty to report women you suspect of having illegally terminated their pregnancy. We've changed our laws. There are no exceptions. And anytime you have a good faith suspicion that a woman has done something to end her pregnancy, you must call us and notify us. The truth is that they don't have to, because they've got this countervailing obligation of confidentiality. But if they do make a report, the law permits them to be immune from being sued for breaching confidentiality. So same possibility that I thought, my hypothesis, same could happen. Like a doctor who was inclined to report can report without fear of punishment, and a doctor who's inclined to honor confidentiality can't be prosecuted for not reporting. Right? So I figured, okay, so what you'll see is the doctors who are staunchly opposed to abortion making the calls to police, but instead I found something totally different. In the single best study of abortion in the country, really the only sophisticated study, they went actually from police station to police station throughout the country, tracing every single report from a doctor's office or from a hospital to the police, and in every single case there was one fact in common. It came out of a public hospital. There was not a single report of a private paying patient in the entire country. Every single report came out of a public hospital, which is where the country's poorest people go for care. The other thing that happened, right, so like amazing, right? And just notice also 10 years, complete ban, 20,000 abortions by the government's estimation in a 3-year period, 35,000 a year by the Guttmacher's estimation, 129 reports. So that's sort of interesting too, right? This is what full enforcement looks like. As appalling as the public-private gap was the women who got reported and the cases that got reported left me absolutely just slack-jawed. And I'm going to tell you about them at the risk of just like it's a kind of a whole nother hour that we could spend talking about it. So if I go fast and we won't spend an hour on it, then I'm leaving time for questions, and so ask me questions. But what's interesting about these cases that get reported is that they're actually not early abortions at all. They're not what you'd think of and what people who oppose abortion, who want it to be illegal, think of when they think about why we need to stop abortion. Instead, what you find are cases of women who have late obstetrical emergencies, who at 7 months or beyond in their pregnancy have a disastrous out of the hospital delivery of a wanted baby, arrive at the hospital poor and bleeding, and the doctors suspect, because there is such a gulf in terms of class and just like life, their life circumstances, that the doctors suspect the women of having terminated, of having wanted to do something to end their pregnancy, because after all, they can't imagine how she possibly could have wanted to have another baby. So to tell you a little bit about these cases, I'm going to actually walk you through two of them in some detail. So this is Cristina Quintanilla. She she's at her grandmother's house talking to me, but this is the house she was living in when she was 7 months pregnant, and that's a baby that she had later. But she was pregnant with her second child. She had her first child at 14. She was 17 years old, pregnant with her second child, and her husband, common-law husband, was living in the States and sending money back. I'd say probably 60% of the Salvadoran gross national product is actually comprised of money that's sent back from Salvadorans working here in the States. He was sending back $75 a month, so she was feeling pretty terrific. That was a lot of money. She moved to her mom's house to be near the hospital when the baby came. Her mom was of fairly modest means. You can see there's a little grill in front of the house. That was where her mom would make pupusas, and that's sort of how they lived. And they decided not to have a baby shower so she could have more money so that she'd be able to actually live with her babies separately, not in her mother's little house. And one night when she was 7 months pregnant, she had a sudden extreme pain. Turned out to be a contraction, dragged herself bleeding down the hall to the bathroom, passed out. Mom heard the noise and took like the tin can in which the family money was gathered and begged a neighbor to drive them to a public hospital, where she very quickly was spotted as somebody who was pregnant. Where's the baby? Where's the baby? They called the police. She was shackled to the bed, and 3 days later was arrested. The case against her was prosecuted as a manslaughter case, meaning it's a homicide, but you didn't intend to kill, and so it would have been sentenced, I think, with 4 years. They have a pretty rigid sentencing structure there, but the judge was so outraged by the callous loss of life that he decided to change the charge on his own to murder, and she was given 40 years. When her lawyer met her in prison, he was actually defending another woman who was in prison. When he met her, he was like, "Oh, we can fix this right away. Judges aren't allowed to elevate the charges. Like, the prosecutor decides what the crime is, not the judge." And so, like, literally, she was out of prison. I mean, she just happened to have the good luck to meet Dennis, her lawyer, and then within a couple of months, she was out, and her life went on. So Manuela was not as lucky, and you can see right away, this is Manuela's house. You can see some of the class differences. So Manuela lived with her parents in a rural village. She had 2 kids, and this is the home that they lived in, and she was, I think, probably 8.5 months pregnant. It was the rainy season in El Salvador, and she was walking down the steps to the outhouse behind her house, and she slipped. And she delivered her baby into this toilet. The family, again, took their entire savings, brought her to the hospital. She was arrested, convicted, sentenced to, again, 40 years for murdering her child on the theory that she had deliberately thrown herself down the steps, because how could she have had a third child? How could she have wanted a third child? And while in prison, she got Hodgkin's lymphoma, which went undiagnosed and untreated, and she died 2 years after being incarcerated. So, so the advocates working to change the abortion law, the face of their movement, the movement in protest to the complete ban, is not the women dying from abortions. It's actually the women innocent and convicted and in prison. It's one of the weird puzzles of what's going on in El Salvador under the ban. At first, I could not understand the connection between these cases and the abortion ban. I had forgotten, by the way, entirely by this stage about my initial question, which is, what does infanticide look like in El Salvador or in countries where there's a complete ban? And yet, in El Salvador, I actually found my infanticide cases. The women who gave birth alone outside of the hospital, whose babies died and who were arrested for abortion, were a whole lot like the women I met in Ohio, whose babies didn't die because they actually somehow affirmatively wanted to kill them, but because the circumstances of their lives were so desperately grim that the harm to their child seemed almost inevitable in retrospect, right? And the story of trying to see their circumstances across the lines of class and race that we do as a system here, lawyers and doctors alike, and that happened in El Salvador, just suddenly came into focus, right? So El Salvador teaches us that when abortion is banned, it remains commonplace, that it's really hard to catch and punish the doctors or the women who have abortions, that when it's enforced, it catches the wrong women, the poorest women, at least some of whom are completely innocent and didn't want an abortion at all. Now for the news that it's all going to happen here, right? Because so much of this seems like, wow, this just is an artifact of a third world system, right? So all of it would happen here. First of all, abortion is going to remain commonplace regardless of whether it's legal or illegal. It will be facilitated by abortion drugs. Legal or illegal is actually worth dwelling on for a moment, because even if Roe versus Wade is reversed, there's at least 21 states in this country, including Illinois, that have made it quite clear that they're going to keep legalized abortion, right? Abortion becomes something that you make a crime or not under your criminal code. So a state will have a choice of whether to keep it legal or illegal. Illinois will stay legal. Women in Texas will be traveling. Women with money will have access to safe, legal abortion. Women with a little bit less money will have access to drugs. Right? It's already happening. Cytotec, that drug that I showed you, the half of our mifepristone, is for sale in flea markets all along our southern border. We're already seeing it. There are surveys now. There's a survey that just happened in Texas of U.S. women coming to abortion clinics, and they're being asked, did you try on your own to end your abortion before coming here to the clinic? Did you try any remedies to end your abortion? Up to 10% are saying, yes, I tried on my own something. Right? The other sign that it's already happening here is that we're seeing cases of women going to hospitals in the States, hemorrhaging and saying, I ordered drugs online. I took drugs. Right? We're seeing the cases where things go wrong in this country. We're seeing, oh, wow, things are coming into this country illegally, right? These drugs. Women are getting into trouble with them and bleeding. What we don't know is the denominator. We have no idea how many women are ordering drugs and ending pregnancies on their own and not having trouble, because guess what? It works. 90% of the time, no problem. The 10% are the cases of like, ooh, I took it too long, wrong dose, or I took it too late, and they're ending up in the hospital. So again, it's already here, and if you doubt the idea of how powerful that illegal market in drugs is going to be, just pause for a moment and think about painkillers. Right. Law enforcement in this country, like El Salvador, will disproportionately affect poor and marginalized women. Now, I have to stop here because the official position of pro-life Americans, of the pro-life movement in this country, is that women are abortion's second victims and that they're not interested in prosecuting women. Those of you who remember during the election, Donald Trump got in a little bit of trouble saying, yeah, we have to do something about those women, and then had to walk it back the very next day because the official position is we punish doctors, not women. Abortion drugs render doctors irrelevant. There are no doctors to prosecute, right? And even in states that are completely committed to the philosophy of not prosecuting women, we're just going to prosecute the doctors, not the women, we will have our own version of emergency room as crime scene investigation. Doctors will find themselves torn between the duty of confidentiality and the idea that their patient has broken the law. Right? This pressure, like, what do I do? She's broken the law, and yet it's confidentiality. This pressure will intensify a pattern that we already have in this country of prosecuting poor women of color for crimes arising out of miscarriages, stillbirths, or perceived risks taken while they're pregnant. Just to be clear about this pattern, in the years since Roe v. Wade, so in the years since we made abortion legal, since 73, at least 413 American women have been prosecuted with crimes arising out of miscarriages, stillbirths, or perceived risks taken while pregnant. Just this past week, a woman was sentenced to 30 years. She's addicted to heroin. Her newborn died. 30 years in prison for having murdered her child. As in El Salvador, these cases, these American cases, these 413 cases, overwhelmingly involve poor women, women of color, women who seek care at public hospitals, women who don't have the money to buy confidentiality. Right? Banning abortion also will have an indirect impact, and a disproportionate indirect impact on girls and on the most marginalized and vulnerable women. The indirect impact is really hiding in plain sight. Think about the teen motherhood statistics that I gave you. 1 in 3 births is to a teenager. Rates are dropping around the world. Long-acting contraceptives have really changed the world of teen pregnancy and of unplanned and unwanted pregnancy generally. You can see those rates going down. Girls are the ones that are going to be the exception. The more marginalized the girl, the more likely it is that she's going to become a mom. And then all of the public health and economic consequences that follow on from that. The younger you become a mother in this country, the less likely it is that you'll ever get your way out of poverty. The more likely it is that you'll have long-term negative health consequences, not just for yourself, but for your child as well. The other indirect consequence that we're likely to see in this country is one that we see in El Salvador, and that's suicide. In El Salvador, 3 out of every 8 maternal deaths, 3 out of every 8 maternal deaths is a pregnant teenager who kills herself. So what do we do about this? I actually feel like it's important to acknowledge the reason why we have the abortion war that we have, which is that the symbolism of the law matters to both sides, right? Both sides in the abortion war in this country and really around the world care deeply about the law sending a message that they find to be abhorrent. So pro-life world, sort of the pro-life world's outrage that abortion legalizes killing is actually matched by the pro-choice world's insistence upon the full legal autonomy of women. And honestly, I don't see how we're ever going to resolve that ideological standoff. It has a perverse consequence, though. In the meantime, by focusing exclusively, and I'm a law professor, you can accuse me of focusing exclusively on the law. By focusing exclusively on whether it's legal or illegal, we get distracted from what I think is a much better question of how we think things will change if abortion becomes illegal. Abortion's not going to disappear when it's banned, and it's not going to disappear because abortion is driven by socioeconomic constraints. Money, education, work, right? The poorer a woman is, the more likely she is to terminate her pregnancy. In this country, 75% of the abortions go to women within 200% of our poverty line, meaning 75% of abortions go to women living on less than $24,000 a year, right? If we come to understand abortion as a response to the high costs of motherhood, we actually, I think, open the possibility for a new conversation, one that's based on the moral obligation to deal with the conditions that cause women to want to abort in the first place. So I'm going to stop there. I know I gave you a ton of information. I didn't talk at all about Oklahoma, which I'm happy to do. I'm happy to answer any questions that you have, though, and thanks for being such an attentive audience.